Hey guys, Derek here. I'm the founder of CrowdScriptz. Thanks for watching. Look, when someone says health insurance, what comes to mind? I know for many of us, myself included, it's negative thoughts or words. In many instances, it's because we or someone we know has just had a terrible experience with a health insurance company. It's left us feeling that the company is indifferent or even at odds with our well-being. Some of us have chronic conditions that are quite expensive to treat. Rather than helping us to maintain good continuity of care, many times we're denied certain treatments or medications essential to our health. Many of us are healthcare providers who are forced to spend time, money, and other valuable resources completing prior authorizations, medical necessity forms, other various hurdles for our patients to get the medical care they need. It's not to mention the additional hoops we jump through just so we can get reimbursed for our services. And if that's not enough, the cost of health insurance continues to rise year after year as the actual service itself dwindles. Many of us are business owners who can attest to this, as we become less and less able to provide good health insurance coverage for our employees. So what may have began as a good service for the general public and healthcare providers and employers has basically morphed into a hefty burden for the very people that it intended to benefit. So I dare say we stand at a crossroads of opportunity versus turmoil. How can we course correct this insurance problem so that healthcare can be more affordable for our children? Due to the great dignity of every human person, healthcare is different from any other marketplace. In addition to dollars and cents, it requires good old-fashioned reasoning and a touch of compassion. We've already seen the insurance industry erode public trust. We've seen government unsuccessfully try to step in. The issues are polarizing, I realize that, and good arguments are being made on both sides, all sides. The ultimate question is, will we stand by, observing and discussing the problem, or will we jump in to the arena, so to speak, and try to find a solution? Again, my name is Derek Foreman. My company, CrowdScriptz, has decided to plunge into this arena by creating a three-way partnership between providers, patients, and employers. We've dubbed the concept crowdscription, which means we're crowdfunding our medical providers through subscriptions from our members. Our app and online platform provide a no-contract subscription membership for all users, crowdfunding style payments for healthcare providers, and couponing codes for employers. By working together, I think we can create a system that facilitates efficiency, cost-effective healthcare for the masses. Something that has been unicorn status until now, basically. Our membership fees are calculated yearly based on a point system. So what happens is members acquire points, they're called Z points, through healthcare services or products that they obtain. Those are correlated to the complexity of the product or service. So higher complexity, more points. Lower complexity, less points. At the end of the year, the points are compared to the average points of all the members in CrowdScriptz. Members whose points are more than average will have a proportional increase in their monthly fees. But on the flip side of that, if your points are less than average, then you have a proportional decrease in your monthly fees. This enables us to provide a fair payment structure for all of our members while being very transparent and predictable about yearly healthcare costs. And it enables us to provide a fair payment structure for our providers as well. The provider partners are paid twice monthly, once for the patient encounters and again for a partner distribution. So essentially, they're owners in this as well. The distributions are based on the complexity of services and products offered and are intended to cover and hopefully exceed their office expenses. We have also a unique program that we're gonna be implementing over time that allows opportunities for our providers to earn equity in the company and to become true partners. Finally, the employer partners are businesses that wish to provide much less expensive and more transparent healthcare coverage to their employees. By creating an employer account, the businesses are able to receive discount codes and special offers that they can pass on to their employees. Businesses can pay as much or as little as they like, but ultimately the employee maintains their own personal account and does not lose coverage when they leave the job or lose the job. They just may lose their discount or whatever is involved. In addition, each employee is on his or her own schedule. So there's no waiting for enrollment periods or qualifying events or anything like that. You just jump on and off whenever you're ready. So we're still in the process of building the platform, and we need your help, which is why I'm making this video. The most important thing you can do is share the video and website with as many people as possible. This helps us to get the word out and get services in your area. Tell your friends, tell your doctor, tell your cousin's girlfriend, stepmom with the funny name, because you know she'll blab about it. No, seriously. Spreading the word about CrowdScriptz is the best compliment you can give us. Secondly, we're looking for early adopters who would like to subscribe to our a la carte beta service. So although we're not providing full coverage yet, we have kind of an a la carte service if you want to buy one service at a time. Some examples right now are chiropractic and telemedicine. So just check out the site, see what you're interested in. Those who subscribe now before we go full coverage will receive a lifetime discount plus their first month free once we fully launch. So I mean, that's incredible, and we're excited to offer that to you. Super excited to launch this service. We look forward to helping medical providers get back to treating patients and getting patients back to controlling their own health care. So thanks for watching, and go share.